A Bridgeport nonprofit reporting an epidemic increase in fentanyl abuse, just as the CDC releases national data confirming that trend. News 12 Connecticut's Frank Recchia with the story.
As regional director of AMR, overseeing more than 500 EMTs and paramedics across Connecticut, Bill Sheetinger knows all about the deadly dangers of fentanyl.
You know, somebody takes a pill that they think is a prescription pill that a friend gave them, and they don't realize that it's got fentanyl in there and it can kill them.
Nobody knows that better than Iris Seda of Bridgeport, who says her 22-year-old daughter Anna died of a fentanyl overdose that occurred exactly that way back in November.
This is my daughter's urn.
Seda founding a nonprofit called COPE in her daughter's memory.
It is definitely the antidote.
COPE distributes Narcan and educates the public about how to stay safe.
It is even in marijuana. I mean, imagine your child going to try to experiment for the first time and they encounter a batch that has been tainted with fentanyl and your child ends up dead.
What Seda began noticing recently was an increase in the number of fentanyl overdoses being reported to her organization. Then she found out the CDC was reporting an epidemic increase on the national level last month, and it all suddenly made sense. The spike in fentanyl cases locally was part of a nationwide trend.
These substances are being laced with fentanyl to increase their potency. And of course, that makes them far more dangerous and far more lethal.
With fentanyl deaths now often resulting from laced drugs, experts say the best thing is to stay away from illicit drugs altogether. But if you do use, they say never do so alone and be sure to have access to naloxone.
If you're not going to stop using and you're not going to abstain, then use safely.
In Bridgeport, Frank Recchia, News 12, Connecticut.